Welcome back to the deep dive. You've shared some really fascinating sources with us this week, all kind of centering on phobias.
Yes, quite a bit to dig into.
So our goal for this deep dive is pretty straightforward. Use the material you sent to really understand what makes a phobia, well, a phobia.
Sounds good. We can look at the definition, characteristics, impact.
Exactly. How common they are, treatment,
Yeah.
and, you know, where they sit in the bigger picture of psychological stuff. So let's jump in.
Absolutely. It's interesting seeing how these sources together kind of paint a picture of something that can feel very isolating if you're experiencing it.
Right. So definition first.
Yeah.
Based on this material, what are we actually talking about when we say phobia? What jumped out at you?
Well, fundamentally, it's described as a persistent fear and crucially, an irrational fear,
Irrational meaning.
meaning it's directed at a specific object or maybe a situation, even an activity, but the fear is excessive. It's way out of proportion to any actual danger that might be there.
Okay, disproportionate fear.
Yeah.
Got it.
And, as the sources clearly state, phobias are considered psychological disorders.
And maybe just quickly clarify, what does that classification, psychological disorder, mean in this context? What do the sources say?
Right. So psychological disorders generally, as outlined here, involve these ongoing patterns of thoughts, feelings, behaviors
Okay.
that cause significant distress, or they impair someone's ability to function day to day.
So the distress or impairment is key.
Exactly. And a phobia fits right in because that intense fear, and especially the avoidance that usually comes with it, can seriously mess with someone's life, their routine, work, social life.
Yeah.
It causes real problems.
That makes sense. It's not just being a bit scared of something, it's persistent and disruptive. Okay, let's get into the characteristics then. What are the defining features, the sort of telltale signs?
The sources highlight a few core things. Number one is the nature of the fear itself. We said intense, irrational.
Right, disproportionate.
Disproportionate, exactly. It's a fear that just doesn't square with logic or the actual threat level. Someone might know logically that, say, a house spider isn't going to harm them.
But the feeling is totally different.
Totally overrides the logic. It's this overwhelming terror.
That disconnect seems really central.
It is. And that intense fear then drives the second key characteristic, avoidance.
Right. Trying to stay away from the feared thing.
Exactly. People with phobias often go to really extreme lengths to avoid whatever triggers the fear. And while avoiding it might give some, temporary relief from the anxiety,
It creates its own problem.
big time, it can seriously shrink their world, limit their activities, their opportunities.
Like someone afraid of flying might miss out on holidays or job chances.
Precisely that kind of thing. Or someone with a social phobia avoiding parties or meetings. And then there's what happens when they do encounter the phobic stimulus or even just think about it.
The actual reaction.
Yeah, the sources talk about a whole range of emotional and physical responses. Panic attacks, heart racing, sweating, shortness of breath, trembling.
Wow.
Just this overwhelming feeling of anxiety and dread. It sounds, frankly, terrifying.
Yeah, it really paints a picture of how much it can take over. So let's talk more about that impact. It sounds like it ripples out quite far.
Oh, definitely. The material really underscores these wider consequences. Like we said, the avoidance can impose huge limitations. Think about agoraphobia, the fear of open spaces or situations where escape is hard.
Right. That could make leaving the house incredibly difficult.
Almost impossible for some. Or social anxiety disorder, making basic interactions feel like a minefield. So it's not just the fear itself.
It's the knock-on effects.
Exactly. How that fear impacts activities, relationships, career, just general well-being. It leads to significant distress, constant worry.
Must be exhausting.
Totally exhausting. Mentally and emotionally draining, constantly scanning for the threat, planning avoidance strategies.
Makes sense. Okay, shifting gears, slightly prevalence. How common are phobias? Does the sources give us a feel for that?
They don't give super specific numbers in the materials you shared, but they definitely align with the general understanding that phobias are, well, surprisingly common.
Oh, really? Not some rare condition.
No, not at all. It's generally accepted that a significant chunk of the population will experience a phobia at some point. Maybe not always severe, but the experience itself isn't unusual.
That's interesting, maybe a little reassuring for someone going through it. So if it is relatively common, what about help? What do the sources say about treatment?
Yeah, and this is important. The sources are quite positive here. They emphasize that effective treatments are available.
Okay, like what?
Therapies like exposure therapy and cognitive behavioral therapy, CBT, come up frequently.
Right. Can you briefly unpack those? Exposure therapy sounds intense.
It can sound intense, but it's done very carefully. It involves gradual, repeated exposure to the feared object or situation, always in a safe, controlled way. Yes, step by step. The core idea is that through this safe exposure, the fear response starts to decrease naturally. Habituation, essentially.
Okay, and CBT.
Cognitive behavioral therapy often includes exposure techniques, but it also works on the thinking patterns, identifying and challenging those negative, irrational thoughts that fuel the phobia.
So tackling the thoughts and the behavioral reaction.
Exactly. Kind of a two-pronged approach. The sources might also mention medication sometimes, not usually as the main treatment, but maybe to help manage severe anxiety symptoms alongside the therapy.
But the main message is that help works.
Yes, definitely. Phobias are treatable.
That's really good to know. Okay, last main area. Where do phobias fit in the grand scheme of psychological disorders? How are they classified based on this info?
Generally, as you'd probably expect, they fall under the category of anxiety disorders.
Makes sense, given the core symptom is intense anxiety.
Precisely. And the material, I think it was pages 48, 49, helpfully breaks down different types of phobias too.
Oh yeah, I see that. It lists things like natural environment phobias, like
Yeah.
storms, heights.
Exactly. And animal phobias, spiders, snakes, dogs. Then there's a category for blood injection injury fears.
Oh, right. Fainting at the sight of blood.
That kind of thing. Situational phobias like flying, elevators, enclosed spaces, and then a sort of catch-all other category.
It's a wide range.
It really is. And the sources also mention specific named disorders like agoraphobia, which we touched on, and social anxiety disorder, the fear of social situations, scrutiny.
Seeing those examples really shows the diversity, doesn't it?
Yeah,
From very specific objects to broader situations.
absolutely. It highlights that theoretically a phobia could develop around almost anything. The specific focus might seem strange to an outsider.
But the experience for the person is very real.
Incredibly real, and as we've discussed, potentially very debilitating. It impacts their whole life.
Okay, so wrapping this up. We've dived into the sources you shared on phobias. We've seen they're defined by that persistent, irrational, out of proportion fear.
Right. Characterized by intense anxiety and often significant avoidance behavior.
Which has a real, sometimes massive impact on daily life and well-being.
And they're actually pretty common, more common than people might think.
But crucially, there are effective treatments available, like exposure therapy and CBT.
And they're classified under anxiety disorders, covering a huge range of specific fears, from animals to situations to social interactions.
Yeah. Looking back at all this, what really strikes me is just the spectrum of how humans experience fear.
That's a great point. We all feel fear, anxiety. It's normal. But with phobias, it gets amplified, zeroed in on something specific, and grows to a point where it really disrupts life.
It makes you think, doesn't it?
Yeah.
How many fears that seem irrational on the surface might be causing real suffering for someone? Maybe that's the final thought for our listeners.
Yeah, reflecting on that range of experience, the importance of understanding, maybe empathy for these conditions, even if the fear itself doesn't make immediate sense to us.
A very important point. Well, this has been incredibly insightful, really getting into the details based on the material provided.
Agreed. Good stuff to explore.
Thanks again for sending these resources in. And to everyone listening, keep those topics coming for future deep dives. We're always curious about what you want us to explore next.